Hello, I am Judith Finlay, Technical Director at the Binding Site. In February of 2009, new guidelines were published for the use of serum-free light chain assays. In the next 5 minutes, I will present a summary of those guidelines. Serum-free light chains assays are assays for free immunoglobulin light chains. There's an assay for the kappa light chain, an assay for the lambda light chain, and the kappa to lambda ratio is also clinically useful. The International Myeloma Working Group is a group of greater than 100 myeloma specialists from around the world, and they have decided that serum-free light chain assays are important for assessing monoclonal gammopathies. They've come to consensus on how to use the assays, and they have published their recommendations. The International Myeloma Working Group Guidelines for serum-free light chain analysis state that the assays can be used for 3 different purposes: diagnosis, prognosis, and monitoring. For diagnosis, they suggest you take serum-free light chain assays, serum protein electrophoresis, and serum immunofixation electrophoresis, and that these 3 tests are sufficient to screen for all plasma cell disorders, except AL, or antibody light chain amyloidosis. For AL amyloidosis, they recommend a 24-hour urine immunofixation electrophoresis also be added into the 3 serum tests. For prognosis, they say that serum-free light chains are of major value for every plasma cell disorder. For monitoring, they say serum-free light chain assays can be used for AL amyloidosis, oligosecretory multiple myeloma, and patients with complete response to test for stringent complete response. First, for diagnosis, if you have a patient you suspect has a monoclonal gammopathy, you can take serum-free light chain assays, serum protein electrophoresis, and serum immunofixation electrophoresis all together and use those tests, and there's no need to do 24-hour urine studies. 24-hour urine studies are hard to perform because it's hard to get patients to comply with that. And in the guidelines, they cite a Mayo Clinic study that showed that serum-free light chain assays are actually half the cost of performing urine studies. However, if you have a patient suspected of having AL amyloidosis, the authors suggest adding a 24-hour urine immunofixation electrophoresis to the 3 serum-based tests to increase diagnostic sensitivity. Second, for prognosis, the paper combines prognostic data for serum-free light chains from the literature. The data show that serum-free light chain measurements can predict probability of progression or overall survival. The authors state that this was an unexpected finding. They note that high serum-free light chain concentrations can be associated with immunoglobulin H translocations or increasing tumor burden. They state that serum-free light chain assays are useful for the prognosis of all plasma cell disorders, including monoclonal gammopathy of undetermined significance, smoldering myeloma, which is now more recently being called asymptomatic multiple myeloma, solitary plasmacytoma, multiple myeloma, and AL amyloidosis. Third, for monitoring, the guidelines say that serum-free light chain assays should be used to monitor AL amyloidosis and oligosecretory multiple myeloma. Patients with oligosecretory multiple myeloma actually have paraproteins that are difficult to quantify with serum protein electrophoresis. Finally, the authors of the guideline recommend using serum-free light chains on patients with complete response to test for stringent complete response. The definition of stringent complete response is a complete response with a normal serum-free light chain kappa to lambda ratio and the absence of clonal cells in the bone marrow. In summary, I've shown you that the International Myeloma Working Group Guidelines for serum-free light chain analysis show that the assays are useful for 3 different purposes: diagnosis, monitoring, and prognosis. For diagnosis, they say to use serum-free light chain assays, serum protein electrophoresis, and serum immunofixation electrophoresis, and these 3 tests are sufficient to screen for all plasma cell disorders, except antibody light chain amyloidosis. AL amyloidosis, they also recommend using a 24-hour urine immunofixation electrophoresis to be combined with the C3 serum-based tests for diagnostic sensitivity. For prognosis, they say to use serum-free light chain assays, and they are of major value for every plasma cell disorder. For monitoring, serum-free light chain assays are useful for AL amyloidosis, oligosecretory multiple myeloma, and patients with complete response to test for stringent complete response. I hope this summary has been helpful to you. For more information, please contact us at the binding site.